Now you all know how to treat hypoglycemia. You give glucogel or IV dextrose or IM glucagon if the patient is not conscious. But do you know the definition and the causes of hypoglycemia? Caught you out. So here we go. The Whipple's triad, a blood sugar less than 3.9 millimolars per litre, signs and symptoms which usually occur when it's less than 3, resolution of the symptoms when the blood sugars are restored to normal. Insulin is a peptide hormone that is secreted from the beta cells of the pancreas and the islets of the Langerhans. It does many things, but here are 3. Number 1, it increases glucose uptake and usage. Number 2, it inhibits gluconeogenesis. Gluconeogenesis occurs in the liver. It uses non-carbohydrate sources such as lactate, amino acids, and glycerol from fatty tissue to convert it to glucose. And number 3, it inhibits ketogenesis. So importantly, here are 5 causes of hypoglycemia in clinical practice. Number 1 is medication, most commonly insulin. Either insulin overdose, insulin with a missed meal, or missed timing of insulin doses. Sulfonylurea abuse, very common in those with psychiatric disorders. Number 2 is liver failure. Gluconeogenesis occurs in the liver, so without any gluconeogenesis, hypoglycemia results. Number 3 is adrenal failure. The adrenal glands produce cortisol, which stimulates gluconeogenesis in the liver. And number 4 is starvation ketosis. Now, if you starve yourself for a few days, you don't get true hypoglycemia. This is because the body reverts to using non-carbohydrate sources in gluconeogenesis, as we mentioned before. However, if you starve yourself for a long time because you're anorexic or you've got underlying liver disease or Addison's disease where you've already got reduced gluconeogenesis, starvation will lead to hypoglycemia. And number 5 is insuloma, a rare neuroendocrine tumor that secretes insulin from the pancreas regardless of the glucose levels in your body. Patients tend to have hypoglycemia in the early morning and the evening before meals when their glucose levels are at their lowest. In addition, they get rapid weight gain because due to the hypoglycemia, they have a persistent feeling of hunger, so they eat more. C-peptide is a hormone that is released in the body when the pancreas produces insulin, so it goes up with endogenous insulin release. Therefore, in insuloma, you have a high insulin level and a high C-peptide level. However, if you inject too much insulin, you'll have a high insulin level but a low C-peptide level. Sulfonylureas stimulate the pancreas to produce more insulin. You have a high insulin and a high C-peptide. However, the sulfonylurea screen will be positive, detecting sulfonylurea abuse. Now, not only can you treat the hypoglycemia, but you can investigate and identify the cause. So practice, 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 and happy glycemia, everyone! And don't forget to subscribe.